Earlier this month, the Washington State Department of Health announced updated guidance for what to do when someone is sick with COVID-19, the flu, RSV, or other respiratory viruses.
And while much of that guidance is similar to recent updates from the CDC, the state DOH's guidance offers some additional recommendations. And joining us to continue the important conversation this morning is Dr. Scott Lindquist, the state epidemiologist for communicable diseases. Doctor, it's nice to have you with us this morning.
Nice to have you guys. Good to see you guys again.
Yeah, it is after all this time. So let's talk about some of the changes in this guidance from the CDC and what additional guidance are we seeing come out of the DOH and what they're providing?
Yeah, so like you said, about a month ago, the CDC changed the guidance for when you should return to work or school or function after having COVID, and took a more general approach to if you have RSV or flu or COVID, here are the things you should do. And instead of having a strict time period, say 5 days where you couldn't return to work or you had to have a test that was negative, it's really now all three are based on symptoms. So once your symptoms are starting to improve, so that's at least 24 hours. And, you know, it's a little light on the details of what does it mean to have symptoms improve. But once your symptoms improve, you really can head back to school, work, or your environment where you're around a lot of other people. We took that here in DOH and we added a little bit of caveat to it. And essentially what we're doing is we're transferring the responsibility of guidance really to the public. And it's based on common sense and it's based on respect. And what I mean by that is common sense is, look, if you're 24 hours into this and you're still ill, your runny nose and cough has not improved, well, you really should not be returning to work or school or otherwise. That's common sense. We're shifting that into the hands of the public to do this. And there's no appetite from governmental entities to do masking mandates and things now. But there's still, in our journey through COVID, as many of you guys know, COVID really, the first case was here in Washington State. We have been doing it longer than any other state. So we have a lot of experience, and we know that COVID can be infectious and dangerous to immunocompromised folks or the elderly. So we put some caveats in there to really say, look, if you're around someone in your family, for example, if your husband or your wife or your grandma or your cousin has an immunocompromising condition, suppose they're getting something for cancer, chemotherapy, you really, really should not be around them. And if you are around them, you should be wearing a mask. I mean, there's a lot of common sense in respiratory viruses that I think we didn't heed prior to COVID. Things like wash your hands, cover your cough. And I love this one. It's like, don't cough into your elbow. Well, look, you can't get back here to cough into it. What we're talking about is sneezing into the crook of your arm. Cover your cough. Wash your hands. Wear a mask if you're going to be in a congregate, we mean a close environment setting, or around someone who's going to be immunocompromised. Be a little more conservative. The infectious period of COVID in particular has not changed, but we do recognize a lot of people aren't getting tested anymore. A lot of people, and some for a very good reason, they don't want to get tested because they don't want to be out of work for a week because they don't have enough sick time or they don't have the ability to do that. So recognizing that people are getting symptoms and that COVID is a much different presentation now than it was with the first cases, we're saying for all three viruses, use common sense. Do not go to work or school within that first 24 hours, and don't return if your symptoms aren't improving. And that includes not having a fever for 24 hours. And that is really not having a fever with the addition of Tylenol or ibuprofen. This is all a great way to be ending a pandemic and moving on, but still retaining protections for the most vulnerable and still being cognizant of the lessons we learned during COVID.
So where are we at right now? What respiratory viruses are you and your department most concerned about?
Yeah, so where we are now is we have indicators where we're monitoring RSV, flu, and COVID. And we work with CDC and some modeling about what is a threshold for when the season is here. All three of those indicators, flu, RSV, and COVID, are now below the threshold. And so it appears that we are starting to end this respiratory season. Now, flu's doing this funny thing where it's having a little bit of an increase in cases. So again, this advice from the CDC or the augmented advice from DOH really applies right now also.
You know, we know that vaccinations are an important tool that are out there. And for anyone that's still kind of on the fence about getting vaccinated for one of these viruses, especially when it comes to COVID-19, what is your message to them now, 4 years into the pandemic? How do you encourage people to get vaccinated and protect themselves and others that are around them too?
Yeah, well, here's what I've learned from COVID. Everyone has a very strong opinion about this. Opinion. There is science that shows for or against, and I'm a little hesitant with just pulling out science to support my own opinion. And what I really rely on is what we observe. And what we observe is the hospitalization and the death rate for any of these viruses are much higher in those that are not vaccinated. And people can debate that with their opinions, but the fact of the matter is we measure this, and what we see, that experience really leads me to say your best chance of avoiding a hospitalization or a death, especially if you're immunocompromised or older, is to get these vaccines.
All right, Dr. Scott Lindquist, thank you so much for joining us.
Thank you guys for still paying attention to this issue. I really appreciate it. You've been there the whole time.
Certainly.
Really appreciate it.
It's always important to keep the community updated on where things stand. So we appreciate you being part of that process. Thank you. And thanks for all the work that DOH is doing. You know, you and I were just sort of talking about how we're 4 years into this thing. It's hard to believe that 4 years has passed. And it's still a concern that's out there, particularly COVID that we're talking about. But, you know, even though it's springtime and it's March and flowers are still starting to bloom, you know, flu and RSV and COVID still very much a concern around here.
Yeah, and if I can look at one thing that I think is maybe a positive that we're doing now that we weren't doing before the pandemic, you think about those immunocompromised people, maybe the elderly or people who are going through cancer treatment, as he mentioned. 5 years ago, it'd be very hard for me to imagine someone wearing a mask.
Oh, yeah.
Because it just was not part of our culture specifically, maybe in other parts of the world. Whereas now, that's a little more commonplace. I'm not saying they do it every single day, but people would be more likely to take that next step to wear a mask if they're around someone if they know they aren't feeling well.
Yeah, particularly, I mean, I walked into a doctor's office just a couple of weeks ago for, you know, an exam, and everybody was wearing masks still in there. So it's still part of the process that's out there, and certainly something that we didn't necessarily see before the pandemic hit.
And yet we've also come a long way from like washing our groceries. We've come a long way.
Very long way from 4 years ago. My goodness, so much has changed.